This is an ultrasound study of a primary gravida, age 23 years, her first ever ultrasound. What we see is that the ventricles are dilated with intact thalami, and here you see the thalami are intact, CSP is seen, and this is the dilated ventricle in this view. The gestational age is 34 weeks, as the femur length is 6.59 centimeters and abdominal circumference is 301.5 mm. Both these correspond to the gestational age of 34 weeks, and the fetal weight is 2.39 kilograms. So let's proceed further. While you are seeing this now, that the anterior facial structures are intact. I show you. Now here you see the dilation of the lateral ventricles, both sides, and the cephalic presentation. This is the cephalic presentation. This is the choroid plexus. This is the choroid plexus. This is the cortical mental. Little bit of cortical mental is preserved. So thalami and falx cerebri in front of you in this scanning plan. This linear structure is the falx cerebri. So this is the eye of the fetus, and the facial structures are normal. See, this is the nose. These are the two nares in this view. See, this is the nose, two nares, no evidence of any cleft palate or any facial deformity is seen. Okay, so this is the eye. You can see the lens also within the eye. Now I'm showing you a magnified view in that. What else you see in this fetus is, apart from the hydrocephalus, dilated lateral ventricles, so now coming towards the body area, there is this is the vertebral column, and the vertebral column does not show any anomaly at the region of the neck or cephalic area, and this is the vertebral column at the caudal end of the fetus. No anomaly seen relating to the now this is relating to the vertebral column. Now in this you see the thickness of the skin up to 10.7, and this area is the chest of the fetus, that is fluid. This is the fluid within the chest, and the skin is thin up to 10.7 millimeters. In this view, what I'm going to show you is the chest of the fetus, and while we see that, Now this is the lung tissue flapping within the pleural effusion in the left chest. This is the hydrothorax, massive hydrothorax. This is the lung tissue, and you can see that it is flapping. And if you keep this area in your mind, this is in view, this is the heart of the fetus. So this is the cardiac activity. Here we are seeing the heart. This is the heart of the fetus. And the cardiac activity is 133 to 135 beats per minute, which is within normal and shows normal waveform as well. In this view, you see bilateral massive hydronephrosis. This area, this is the lung tissue. This is the lung tissue, and this is all fluid within this chest. This is the view of the chest of the fetus, and you can see that there is thin skin surrounding this chest wall, measuring 10.3 in this view. And with that you can see the heart, the cardiac activity. This is the heart and this is the cardiac activity seen. Massive hydronephrosis. Sorry, massive hydrothorax. This is the heart, this is the aorta, this is the aorta. Now this is the liver. This is the liver, this area, this is the liver, this is the gallbladder. And let me place some gel. This is the femur. The bone calcification is okay. This is the kidney. Here you will see the kidney. Yeah. This one. This is the kidney. Kidney is normal. This is the aorta. Whole length of the aorta. Fluid in the chest, sparing the pelvic cavity. This is the this is the gallbladder, this is the liver, and this is the stomach bubble. This is the stomach bubble. This is the liver. And this is the gallbladder, tear-shaped structure. This is the chest filled with fluid. This is the chest filled with fluid. This is all fluid. And this area, which I am going to mark as L, is the lung tissue. See, this is the testes, the male fetus. See the testes, the scrotal sac. This is the scrotal sac. These are the two testes. This is the fluid within the both hemiscrota. Hydrocele is seen. Bilateral hydrocele is clearly visualized. This is the penis along with penis. Here you see. This is the penis. This is the penis, bilateral hydrocele, scrotal side. Now, this is the umbilical cord, two arteries, one vein. Clearly seeing the scrota with the scrotal sac, bilateral hydrocele, penis, femur. This is the abdomen. Kidneys we did saw is normal. Now placenta is fundal. It appears here, yeah. This is the placenta. It's fundal with no evidence of any anomaly relating to it, and the single largest amniotic fluid pocket without including the fetal parts and or the umbilical cord measures just give me, as structures come in your view, my view, my routine is I see them, because otherwise we lose them. Okay, now short of gel. This is the fingers. 1, 2, 3, 4, 5. These are the fingers, hand fingers, clenched. Now let's try to get the single largest amniotic fluid pocket in vertical without including the fetal parts and or the umbilical cord. The maximum where I can get, I will go for it. It takes some time at time. It takes some time. No hurry or worry whatsoever. This is the fetus hand. You can see the fingers also. Yes, good view. Capture it as second time. It may take some even more time of your scanning. Get it where you get it. So it appears to be a case of polyhydramnios as well, by my eye interpretation, by my experience. Okay, this is the better view to get the largest amniotic fluid pocket is vertical. No, it is not. See the fingers? Okay. I think we are going to spend some time on getting the largest amniotic fluid pocket in one view. Okay. Okay, this one. Not satisfied. And you can see small amount of meconium as well. The fluid is not clear. See, I had reduced the gain to show you, and that's why you are seeing the fluid without echoes. It's not free of echoes. The amniotic fluid contains echoes. These are low level floating echoes in it. That's meconium. Because I am trying to get the amniotic fluid pocket where maximum vertical without including the fetal part becoming difficult at the moment. But the one I got initially was really good one, and measured 15 centimeters. So sorry, but this is going to suffice, I think so. Well, yes, this is at least this shows 14.0 up to 13 is considered 12 to 13 is considered normal. However, in this at the third trimester, especially in 34 weeks gestational age, it's unusual. It's not a normal finding. So there is polyhydramnios even with eye interpretation, and the fluid is not clear. It contains echoes. You see meconium is there. This is all meconium. You can see the movement of the fluid within it. Clear movement. This is the amniotic fluid. These are the echoes within it. And this is the transverse view of the. So this is in fact a case of thick skin around the fetal body, skull, dilated both lateral ventricles, this, and massive hydronephrosis, hydrothorax bilateral with so this is with hydrocele, bilateral hydrocele. This is the urinary bladder. Here we are. Compressed lungs. Thank you very much, and this is our case of the day regarding the fetal anomaly.